Hi, digestible listeners, and welcome back to the podcast. I'm Staci, along with my sister Melissa. And here at the Digestible Podcast, we like to bring you all the health and wellness information you need in an amount of time that your busy day can handle.
So, Staci, it is so amazing when we talk about the scale of impact that working on school lunch programs can have.
I never would have thought of it.
Oh my gosh.
It's crazy. I don't know why I never really thought about it or considered it.
Yeah, and it's not just about changing children's health. It's about our environment. It's about sustainability.
Our healthcare system. It's about future generations. It's so massive. And everyone should listen and pay attention and get involved or think about getting involved, even if your kids aren't school age anymore or you don't have school age children yet, because this is important.
It is, and it impacts all of us, including our children. So, Staci, who did we have on today?
Today we had Natalie Linden, who is the COO behind Eat Real's bold mission to put real food on the table at home, at school, and in local and national policy. With 20 plus years experience guiding world-class brands, Natalie brings sharp strategic execution that leaves room for magic, ensuring Eat Real's message breaks through, driving demand for real food in schools across the country, and improving the perception of school food for districts nationwide.
Yes, and Eat Real, eatreal.org, for those of you who want to check them out online, exists to prevent diet-related illness before it starts. Their K-12 certification program reaches more than 1 million students nationwide, and they're growing. And it gives school nutrition leaders the insight, data, and support they need to make their meals more nutritious, delicious, and responsibly sourced. As the only doctor-led children's health nonprofit in the school food space, Eat Real drives nutrition access, public awareness, and state and national nutrition policy to put real food on the table for our nation's kids.
Which is so special. And also, just on the heels of Dr. Mark Hyman's podcast, he just had the CEO of Eat Real on his podcast. So we kind of feel like we're copycatting, but we had this scheduled long before his ever
We
dropped.
So did, but the timing's great. Anyway, thanks to Natalie for joining us. Hi, Natalie. Welcome to the podcast. Okay, well, let's dive in. So can you help us and our listeners understand why it's so urgent to improve school food programs here in the United States?
The way that we try to talk about it is that our kids are facing a health crisis. They are seeing diseases that never used to be seen in kids, things like type 2 diabetes and prediabetes, cardiometabolic risks, so, precursors to heart disease, fatty liver disease, anxiety, depression, ADHD, and all of those things are now belonging to a class of diseases called ultra-processed food-related and lifestyle disease. 67% of our kids' diets are ultra-processed.
Wow.
And so, Eat Real was founded by doctors who were seeing these effects in their pediatric practices and were trying to figure out how they could find an upstream solution to the problem. And where they landed was school food, because our public schools are the largest restaurant chain in the nation. With about 100,000 locations, más o menos, they have more locations than Starbucks, Subway, and McDonald's combined.
Wow.
I never thought of it that way.
Right? Isn't that crazy? So, and they serve 7.5 billion meals a year.
Wow. 7.5 billion meals a year going to our kids from these school food programs.
And I believe that's just breakfast and lunch. And many schools also serve a supper. That's probably not included in that number. So that's a huge amount of meals. And then when you look at the kids that are participating in the National School Lunch Program, that is to say the kids who eat food at school, there's 30 million of them. And they rely on those calories as much as 50% of those calories. And for some of those kids, it's 100% of those calories. They're the only food that they're eating each day. So if we can change what's on those 7.5 billion trays a year, we can reverse this trajectory of this health crisis.
And change the world. Yeah.
And make our kids live, longer, healthier lives than we do, which right now they're not on track to do. Today's 3-year-olds are on track to live potentially shorter and less healthful lives than their parents.
That's crazy. I mean, it's supposed to be getting better with every generation, and now we're going backwards.
Exactly.
Wow.
Wow. Yeah.
Okay. Well, a lot of this feels like it's in abstracts, but you've been on the ground and you've seen the school districts, like you've been working with school districts throughout the country. I know I've reached, I think it's now, is it 1 million school children, which is so exciting. And you're on track to do even more. So you've seen like real world examples of changes that have been made and outcomes that you've like specific outcomes and stories, like testimonies. Can you share some of those with us?
So exciting. I think one of the real benefits of our program is that it's incredibly data driven. It's inherently data driven. So it's a certification model, which means that we're assessing a district's menu, every calorie they serve, every ingredient, all their product formulation statements. So we can actually give them a vision, a holistic vision of what they're serving and help them make shifts. And so then they end up with those before and afters, right? So, we had a food service director that was able to walk into a school board meeting last year carrying a radio flyer wagon full of bags of sugar, and he plonked 3.5 bags of sugar, 34 pounds of sugar, onto the table in front of his school board and said, that's how many pounds of added sugar per student per year that I've been able to remove from my menus. So
That's very
not only
impactful.
right, and it's impactful for a lot of different people in that ecosystem. It's great for the students first and foremost because taking that sugar out of their diets is transformative for their ability to focus and learn, for their long-term health. It's wonderful for the food service director because not only does he have a map for where he can make the most impactful changes, but he's also able to show his constituents, his boss and his school board and superintendent, that he's doing the best he can to help, he's performing his role in the school to help them, help kids succeed. There's also, we kind of think of it like a three for. School food has the potential to, reverse this health crisis. It can strengthen local communities because a lot of what we do is also look at procurement and how we can help school districts connect with their local producers, farmers, bakers, you name it. So we can actually show that, one district had a 123% increase in the number of local farms or produce that they were able to bring in a year. So that's incredible. And then, we also, look at how because school food is such a huge lever for the food system, all those cumulative effects can actually, have a positive impact on our planetary stewardship as well. So,
That's amazing.
it's
Wow.
really it's just such a big lever for us to be able to pull.
Okay, so can you talk about the scale of all of this to give everybody some perspective? Like how much money is spent on school food programs every year, and where does that money go?
So the federal reimbursement rate averages around 450 per meal. So that's the amount
Okay.
of money that the school district is receiving for serving that meal. After labor and operational costs, that leaves districts with an average of about $1.80 to spend on the food itself.
Oh,
Wow.
yeah.
In Texas, just as a for example, a Happy Meal costs $4.80. So we're actually asking these districts to do a lot for too little.
Have you been able to find either cost comparables or cost savings, even though you're getting these districts in touch with healthier food options?
Yes, and I think what's really exciting about the program and just about one of the things we say internally is that we serve heroes and we serve them up to the world. These nutrition services directors are doing the most. It's a really, really challenging job. And they're up against a lot of obstacles, but there is a strong group of them that are really committed to making change. And it's really their tenacity and their ingenuity that makes all of this possible. But, one of the things we look at is, okay, it's unrealistic to expect any district to be able to serve 100% scratch cooked meals in the same way that it's unrealistic for us in our homes to be able to do that either most of the time, right? So, through our program, we're able to help them identify the ultra processed foods or the foods that are less desirable to have in their menus and help them find ways to make healthy swaps. So, an example, we have a food service director who just swapped out his pepperoni, and he's got a better, cleaner product, and it's 2 cents cheaper per slice. Or I'm actually not sure what the, but it's 2 cents.
Yeah, per
Um,
pepperoni.
but it's a cleaner product, and that's,
Wow, that's great.
or I love this example. One of the things we also do is incentivize districts to increase the volume and variety of the fresh produce that they serve. And I love the example of an apple. I actually have one on my desk. So if you serve this apple to an elementary school kid, they're probably not going to eat all of it, and they might not eat any of it because they got a loose tooth, right? If you serve it to a middle school kid, they're probably not going to eat all of it. They might eat some of it, but they've got braces. If you slice the apple, you can serve them less of it. They'll probably eat all of it because they don't
Wow.
have to worry about all this stuff. And then
Hmm.
you can afford to buy organic because you don't need to buy as
Amazing.
many apples.
Okay.
So
Okay.
That's
So
that's
it's
an
great.
like,
example.
wow, talk about value engineering at its like most impressive. Like, wow. Okay, so you can get a local organic apple because a kid might only eat half of the apple, but you're also even maybe covering the cost of, to slice the apples. So it's like a,
And you're
yeah.
making sure that more of the calories that they consume that day are healthy for them. So there's just like really smart swaps that come into play. And I think, that holistic view of what they're serving, of their menus, really empowers district leaders to find the next most important thing they can do with their circumstances to
Hmm.
change their menus. And then it becomes kind of addictive because it's really like a gamification process. They can really game their way to the next solution. And then they find something cool like that Apple solution. And they want to do another one. They want to find the hacks. And they're also
Yeah.
surrounded by a community of other district leaders who are super stoked to do this work and figure out the hacks too. So it becomes this really creative, exciting environment. We also just find, I mean, a big piece of it is make the food delicious. I know that seems silly, but if you make the food delicious, kids will eat it.
They'll
And
eat it.
it's really, at the end of the day, it's a restaurant, right? It comes back to being the largest restaurant chain. If it's a delicious food that is being served at the restaurant, you're going to get more customers. And the more customers you have, the more income you have. And the more income you have, the more you're able to reinvest in the program of what you're serving. So, you know, in the end, we find that a lot of districts actually end up having a cost neutral experience.
That's great.
Wow, that's
That's
great.
great.
You see these countries where they give the kids like these like most nutritional foods, like you're seeing, countries in Europe or like Japan and the kids are eating these super healthy foods and it becomes like this sort of like it kind of removes that stigma, I think, of, well, only maybe the needy kids eat it. I mean, imagine not having being a busy working mom who could afford to like pack your kid a nutritious lunch, but it's like if someone else is doing it for me and I just send my kid to school and I know they're eating well, like the participation in these programs would be like huge and it would be one of those things where that social stigma is gone because I've heard of kids who are on school meals skipping meals because they're embarrassed to eat school meals. That's why in Michigan they do free meals for all, so it's sort of like it's for anybody. And then that way, if you're getting it, it doesn't have to mean you're needy.
Oh,
And
that's
so
smart.
yeah, and so I mean, if you did it this way, like and the meals were healthy, so you've got all kinds of kids, and then their parents feeling really good about them eating at school,
Yeah.
that would be amazing.
Yeah.
Anyway,
Lunch making
okay,
is no joke. So
That's
how
it.
does,
yeah,
yeah, how does Eat Real get paid for? Like, how does this all work?
We're 100% philanthropically funded. So it's a
Okay.
combination of, philanthropists and foundations, corporations, and government.
And are you guys in all the states? Are you,
We're
like,
in
where are you?
21 states. We're just about to announce our 21st state, which is really exciting. And
Congratulations.
thank you so much. We actually doubled our lifetime impact in a single school year this last year. So we ended 2025 reaching 500,000 kids in 11 states and just have really put the pedal to the metal.
That's
We just feel
amazing.
like it couldn't be a more urgent, issue. It couldn't be a more
Mhm.
urgent thing to solve. And so we're
Wouldn't
just,
this be great if this was just a government program instead of you guys working so hard to have to raise the money to do it? But but once you're in it, like once you get people sort of on that into the program, you don't have to stick around other than maybe people maintaining their certifications, right? Is
right.
that right?
It's about a 2-year process. So, we do that initial assessment with the district, and then they take the time they need to make the menu adjustments so that they can go through a final assessment. So we have those beautiful before and afters for them. Um, the certification lasts for 3 years. We find though that the improvements stick around because they work. Once again, it's that, when you see more kids showing up, more excited about food and eating at school, then those changes last well beyond certification. Though I would say, we are finding that almost every district chooses to recertify and games themselves to the next tier.
That's great.
Well, and like, so these kids are basically future consumers, and you're teaching them, and the food and those wonderful food service directors how to eat for a lifetime, right? So this could have a lasting impact well into their adulthood.
That's really the premise, is that, we were looking for that upstream solution. And the earlier you reach kids with healthy food and help them learn about what's healthy for them and help them learn to love it, the more they'll take that into their lives. And that's actually a big part of what we assess, is not just the nutrition and the procurement of the food, but also the change management, to use a kind of a corporate term. But you can't expect to swap Cheetos for broccoli and have kids go, oh yeah, cool, cool, no problem. There has to be a process that makes them feel included in this change and makes them excited about it. So things like, meeting a local farmer or trying a messy fruit, a dragon fruit that's just going to stain all your clothes and give you a pink smile. Um, you know, uh, there things like taste testing new menu items. So kids feel like they've had an input into what shows up on the menus. Once again, that kind of volume and variety, different ways for kids to actually be able to exercise their agency and what they're able to pick off and choose from. Cultural relevance of meals. If you see something at the cafeteria that's similar to what you might find on the table at home and vice versa, those reinforce each other. Giving kids lots of entree options, especially at those high school levels, to keep kids on campus. I mean, all these things are really important parts of how we help make the change, so that we're solidifying, lifelong habits and not just this meal, this moment.
Right. I'm a parent and I want to see like kids in my district eating better, even maybe my own kids eating better. What can I do? How does Eat Real work if I'm a parent and I'm interested in bringing it to my school district?
We have a wonderful page for you with a little form letter that you can send to your nutrition services director. But, I think one of the things that I always like to encourage is actually going and introducing yourself to that person, and coming to that conversation with curiosity and with empathy. They have really hard jobs. They get pressure from a lot of different angles. And the best thing you can do is try to understand where they're coming from and their point of view before you recommend a solution to them.
Mm, I hadn't thought about the psychological part of that.
You know,
Yeah, that gets
it,
complicated, huh?
it's complicated. And I think, there's just so much pressure on food service directors, and there's such a negative stigma around school food. I mean, it's one of the things we also think about a lot about. It's one of the reasons why, I came to this work from experience in branding. My expertise is as a creative director, because when I looked at the landscape of the things that, we could change, maybe the one industry that needs a rebrand the most is school food. And so if you
Mm-hmm.
think about these food service directors as the front line of that criticism, you know,
Yeah, that's rough.
that's
Yeah,
rough.
so make them feel supported, not judged. Ask them questions. That's great. Thank you. Do you have testimonials from teachers?
We are still gathering more feedback from teachers. There's a great story I have from a food service director who, it was the end of the lunch period. it was football player came in. There was nothing left but a chef's salad that was like very locally grown, right? And he was not excited about having to eat a salad. And he took it away, and then he came back, 20 minutes later, and he said, "That was awesome. I guess I'm a salad guy now." Like I had so much positive.
Yeah, but that's what I mean. Like that's
Yeah.
fantastic. Hearing like feedback from the food service workers and the teachers that where the kids are impacted, and hearing that kind of feedback is so great because we're not talking in generalities, we're talking in real world applications. So thank you for that story. That's a great one. We talked about how ultra processed foods um, are impacting all of our health. We've got chronic health issues, things that are showing up in children that haven't before this generation, like the diabetes and the metabolic disorders. But there's also depression and anxiety. So that, I mean, that's like a real thing. So I'm wondering, like, because there's a lot of kids that deal with hyperactivity and they can't sit still. Is part of the goal here also to help the teachers with like kids with challenges? I'm trying to think of how to say this without sounding judgmental about the kids, because a lot of times it's not really their fault. It's like, what are they putting in their bodies and what's it doing to their emotional state?
Yeah, because they'll have the sugar crash.
Anyone who's ever met a kid and given them sugar and seen what happens afterwards doesn't take further research to understand what's going on. Um,
Yeah.
you know, we feel that our role is to support. We consider ourselves a children's health nonprofit, so we exist in the school food space because it's an ideal intervention point to help reverse illness for our kids, including mental health issues. But we are also, of course, very much embedded in the school landscape, and that food service director that we serve is in that role to support learning and behavior and like positive health, positive, academic and athletic outcomes, right? So it's very much a part of what we know food can do for kids. We heard from a teacher who, after they instituted a new breakfast, said, my kids can concentrate. I can absolutely see the results in the classroom. Just making sure that they, number one, have breakfast before the bell, but number two, that it's nutritious, has really changed like the first half of my day and my ability to teach. You know,
Yeah, that's
That's
amazing. And
amazing.
that's like instant evidence. Like, wow, I didn't give the kids the Eggo pancakes and the syrupy, fruit cups that they got, the cut up apple and the, bran muffin or whatever it is that's on that menu that's not making their sugar spike, giving them fiber, giving them some protein. It's excellent. Yeah, that's awesome.
Okay, so we know that Eat Real wants to change what's on kids' plates, but it's more than that. Where else does Eat Real see their work making an impact?
we see ourselves as a children's health nonprofit. So we want to make an impact on that health crisis that's facing our kids and help them stay on the path to a healthy life. And so, we have, as I was saying, a very like data-driven program where we can really show, the increase in minimal processing, the reduction in added sugar, the increase in healthy fats, those kinds of things. And we're also embarking on research, a few different research projects that are going to help us thread that needle between the change in the diet impact, and the actual impact it has on health. And that I think is, how we will ultimately know that we've done what we came to do.
Yeah. And I'm thinking like long term, like imagine the impact it has on national security, because more young people can serve in the armed forces. Right now, a lot of them can't because of obesity and diet related illness. It helps with the economy. So you have people who are actually healthy enough to work, and the local economies. If you're getting food locally, it helps local economies.
And
I
not
mean,
a
it's
drain
just,
on the healthcare system,
I was going to say,
yeah,
human
which,
health costs is a
yep,
huge,
yeah,
yeah.
it's
So it's
really a
amazing.
beautiful mission. It really is. And it's something that I don't know if I really, really thought about it like on this scale, right? Everyone walks around kind of like making fun of school cafeterias, right? Because we've all been in some of them and eaten some strange things. Um, but when you put all those numbers out there, like how large a scale it is and how much of an impact it can actually have on our children's health by providing healthy meals for them. And maybe the parents aren't packing the lunches, which in some cases, obviously, parents can't afford to send them with anything or something healthy. But even when people can afford to send them with something healthy, they're not always choosing healthy. They're going to Costco and getting all the convenience sizes of everything and throwing it in their kids' lunch. What like a beautiful thing.
We have a hashtag that we add to some of our, social posts throughout the year, Parents Against Packing Lunch, because, that first month of the year, we're all excited about it and leaving cute little notes. And we bought new cute shaped toothpicks, for instance. But by October, we all are like, really, again, today, first I have to pack the lunch and then I have to figure out what we're going to eat for dinner. I mean, it is a grind. It's a grind.
It is.
What if you could just feel so great about sending your kid to school lunch?
I would have gladly given up all of the lunch packing.
Yeah.
Gladly.
Right. Well, and to be fair, a lot of the adults, people of our generation, are having to relearn what healthy food means. So why not get the support from the schools and have the kids come home and say, I ate this today, it was really good, and like teaching their parents about the things they're learning, because we all have a lot to learn. So,
and it's interesting because in the other countries, when you see people post pictures of what their kids are eating, these beautiful lunches, they also claim that there's not as many picky eaters because they're all eating the same thing. They're exposed to different things. And at least one of us here was a picky eater. And I have a picky eater. And sometimes I wonder, like, with a program like that, if picky eaters wouldn't be so much of a thing. Like one of my children literally eats only like 10 different things still as a 17-year-old, like high schooler.
Really?
He's not, he eats a variety of things, but like there's not a lot of good variation in there, even though I've been trying since birth.
Yeah, and I send one of my kids to school, but I'd get their lunchbox at the end of the day. It was full of her food. I'm like, what are you eating? Are you not eating? I thought this is what you wanted, And so it's like the idea that she could go to school and have healthy options and get to choose, the likelihood is she'll get some more nutrition that way. So,
what is it? You have to be exposed to a food 15 times. Actually, I think it changes based on how old you are, right? The younger you are, the more exposure you get to a flavor, the fewer tastes you need of it to enjoy it. But yeah, having that opportunity for diversity in what you're served, and having that not all rest on the parent's shoulders is a really huge, beautiful thing.
And it's hard to do at home. Like if you're like, okay, I have to expose my kid to this 15 to 20 times in order for them to try it. You make it once or twice and your kid doesn't eat it. And you're like, I can't make this anymore. I'm like wasting food. This is frustrating. And so you just give them what they want.
Yeah. Yeah. And then, so much of what's in our food system and our diets is engineered to be,
addicting.
Yeah.
Yes. We recently had someone on the show that talked just about that, about food addiction and how the food companies, they have chemists and scientists and psychologists on staff to make the food addictive. It's not about nutrition. And so it's really great to have organizations like Eat Real that like kind of breaks that cycle and says, nope, try this. This is better. Anyway.
Right. It's like our society is programmed to like create addictions for our children, starting when they're young with food. And then, you take it on up through like the fun little vaping things or the little nicotine things you can stick. It's like, where does it stop?
The onus being on parents to actually somehow weed all of that out and manage that and thread the needle. It's so hard. It's really
Well, and as Staci likes to remind us, as soon as those kids can drive, they're going to go out and get the crap themselves. So the sooner we can teach them and get them out of that.
Or bike on their own uptown, depending where you live. But once they have access, like, and some money from babysitting or whatever their little part-time job is, like, you've lost the control.
Yeah. Yeah. And you just have to hope they make some good choices.
We'll say too, you mentioned those beautiful photos of foods at school lunches from other countries. I would encourage you to go to our Instagram because we have some clapbacks on that. I want you to see some of the foods, the meals that are getting served at Eat Real districts. Some of my favorite lunches of my life have been at school. So with our district. So
that's so nice.
It's happening in the U.S. It really is. And
yeah, that's exciting.
I make sure those districts get that shine because it's hard work.
And what's interesting is then they go off to college, hopefully, and dorm food is what you're up against. And
Dorm
it's so
food is next. Dorm food will be next.
right. I mean, it really needs to be on your list. One of my boys went to a school where the cafeteria was like, we got a tour, and they're like, we're farm to fork. And I was like, what? That's awesome. And they had so many varieties of healthy things. And then my other kids go to a school where their dorm is, they say it's barely edible, but it's quite pricey. So just,
University level.
yeah,
for sure.
that could be your next big target.
Okay, Natalie, we like to ask all of our guests the same last two questions. The first, if you could give our guests an action item, something they can do after listening to this episode today, what would it be?
For lunch today. If you weren't the one who picked it, ask your kid what they had for lunch today. And ask them to kind of look around at what their friends are eating too. Because
That's a good one.
yeah, because that's the thing is that school and home are not the only places where kids actually learn their eating habits, right? They learn from their friends, from the visits they take to other people's houses. They learn from all kinds of places. And so, just having a sense of what other inputs are coming into their lunch space is really a valuable insight. I have recently learned, for instance, that my son trades his cherry tomatoes for Reese's Pieces sometimes. And I'm like, how did that?
That's a good deal if some kid is willing to give up their Reese's Pieces for some cherry tomatoes. Who is that kid?
Like, maybe that kid really needed those cherry tomatoes, and that's good, So,
Oh my gosh, I love the kid that wants the cherry tomatoes instead of his Reese's Pieces.
I know, that's hilarious. Fantastic.
That's great.
tomatoes at home, so we're all right. But it's really funny to just really understand what's happening in that school lunch environment.
Yeah, that's hilarious. Okay, Natalie. So here at the Digestible Podcast, we like to say, don't panic, just pivot. Is there a pivot or small change that you've made in your life that's made a big impact that you're willing to share with us today?
Yeah, I'll give you another nutrition related one and related to my son. So I have him, if he wants to get something from a treat, we're out at Trader Joe's or wherever it might be. If he wants a treat, he has to check the back of the nutrition facts. And if it's over 6 grams of added sugar, he has to negotiate with me about whether or not that's going to be something that he gets to take home. Added sugar is not the only thing that you need to look at on a nutrition facts label, but if you're trying to help a kid understand, that basically every nutrition facts label is a warning label in its own way, that it's a great place to start. So the funny thing about it is that I think I'm inadvertently training him to be a lawyer.
I was going to say, is he a good negotiator? How well does this work? Is he successful often?
The daily limit is 25 grams of added sugar. That's the WHO definition. So he's like, well, listen, Mom, this is 12 grams, but I haven't had it. And then we start to get into kind of math. So we're also learning math. There's just like a lot of value.
This is great. This is great.
The best part of it is just that I know, he now has that awareness, and he'll actually come home from a friend's house and say, well, Mom, I didn't have the Oreos because I checked the back of the package, and then I told my friend, like, this has too much sugar in it. So,
oh my gosh, that's great.
So I don't know, he's kind of turning into a narc too, but that's fine. I think
that's right. You're doing some really good training there. You're doing some great training.
So the other day, my youngest came home with the Valentine's Day bag of treats because they had their Valentine's Day party. And she said, can I take one with me in my lunch? And I said, yes. And she's going through it. I'm like, we have to go to school. What's taking so long? She's like, Mom, they all have red 40 in them. I'm like, I'm so glad that you noticed that. I think it's okay for just today, but I won't buy that stuff. And now she knows. I'm like, it's okay if every once in a while, but I'm glad you noticed that. It was just one of those, do I tell her, yeah, throw it out? Do I say, but good for her. Yay.
Yeah.
Woo.
The awareness is what matters. And then moderation, right? We all have to live. So
we do.
Exactly.
Okay, so if any of our listeners are interested in donating to Eat Real or finding out what parents can do, where should they go?
Eatreal.org. It's a pretty cute website. if I do say so myself. So you'll have fun no matter what. There's some really silly illustrations on there. So
Excellent. Eatreal.org. Thanks for coming on today, Natalie.
Yeah, thank you so much for your time.
thanks so much, Melissa. Staci, so lovely.
Thank you for listening to the Digestible Podcast with today's guest, Natalie Linden, COO of eatreal.org. We hope you enjoyed today's episode. If you did, please share us with others. It's the best compliment you can give us. If you have any questions or comments or ideas, please email us at info@digestiblestrategies.com. We look forward to hearing from you, and remember, don't panic, just pivot. The content shared on this podcast is for informational and entertainment purposes only. We are not medical professionals, and the views expressed here are not intended to diagnose, treat, or cure any health conditions. Always consult with a qualified healthcare provider before making any health-related decisions.